we don't know yet. That's part of what we're trying to do. It looks like the plasticity of the brain is changing, so that might be one avenue. But there's also a lot of social, I'm very biological, but there's a lot of social avenues as well. Depending on your children, they could be a lot of social support, and we know that social support can help, especially with stress and mitigating stress. So that might be one reason why their memory scores are better. You're talking about the dementia, probably. Yeah, at the end.
I also think that a child is a pretty significant event.
It's a pretty, yes, you can think of it in two ways. It's enriching, right? An enriched environment is better, you're learning more languages, you're doing more things, but you can also think of it as stressful. There are certainly days where it's very, very stressful. So, whether those two things even out, it's hard to know. But that's something to definitely, this is all retrospective, right? It would be nice to actually ask women their sort of experiences with the children to see if we can gauge stress, relative stress. And there are definitely scales and things that we can do. That's a funny story, if you want to bear with me. So, estrone, the Premarin, is actually derived from horse pee. It's horse urine. I shouldn't say pee, oh my gosh. But it's horse urine. And so don't ask me why they decided to do this, but they distilled it out, and estrone, it's actually, there's a lot of other different estrogens, but I think it's 0.01% estradiol and 50% estrone, but there's a lot of estrogens we have no idea what they do, and they may have positive or beneficial effects. But yeah, I think that this has some implications for what kind of hormone therapy if you decide to go on it, what kind you'd like to go on, depending on your experiences. So in our animal models, we find that hormones probably, they certainly contribute. So women are hypogonadal. What that means is they're very low levels of estrogens, and they're really low for a long period of time. And so we think that it's estradiol that actually goes up to 1,000 times normal levels, and it's sustained it's about 200 for 20 weeks, and then 300 times normal for another 10 weeks, and then 1,000 times normal at the end. And we think that withdrawal from estrogens actually is what makes some women more vulnerable. So we have 2 animal models, and we see increased depressive-like behaviors and decreased plasticity in these models. But absolutely, one of them is surrounding stress. So certainly stress can mitigate it. We're working with Dr. Janine Austin, who's in BC Women's, looking at dietary folate. That also seems to be important, and actually could also play a role in Alzheimer's disease. So it's kind of scary out there. I mean, this is not quite exactly what you're asking, but if you want to boost plasticity, certainly exercise, but diet also plays a big role, and probably has a role in how our brains are reacting to these different drugs as well. And so I can't completely answer that, but I do think it's not completely social. So social support really helps, absolutely, but there's some biological mechanisms that make some women more vulnerable. There's some really good data out there in women showing that women that have had postpartum depression, they're more vulnerable to those hormonal fluctuations. I would love to say so, but this is very early stages of this discovery. I think that's a potential. I think this is something we need to look at, and it's possible that some medical doctors do this anyway. They do it. They call it off-label. I think off-label use, and it's time to sort of collate all this information out there and see if this might work. And that's partly what we're trying to figure out, whether that same mechanism works in women. There's not as many women taking hormone replacement therapy now, but something we're hoping to look at for sure. That's a good question. I would say as long as their coping skills are still there, I try to use humor as a coping skill. It doesn't always work, but yes, they're definitely going to be more vulnerable. But that doesn't mean that that whatever they use to help them overcome, whether it's pharmacological or non-pharmacological, that still wouldn't work later on. Although it does suggest that lack of plasticity does suggest we need an extra boost. And in fact, in Alzheimer's disease, there's actually quite a predominance of depression that occurs. So could be due to that lack of plasticity. Yeah, I mean, I have a slide on just that question, but I won't bore you with it. But Certainly, there are different periods of time when women show that 2 to 3 times more likely. And it's actually during those reproductive years. So between 20 and 50 is the time of greatest risk to develop depression in a woman's lifetime. And then you see the ratio start to even off a little bit. But men, even if you look at a community sample, so if we were to give you guys a questionnaire right now and not say women will endorse more of those depressive symptoms than men, that's not to say that the symptoms might be a little different in men. And I have another collaboration that we're just starting to talk about this, but one of the main symptoms of depression is not just I'm sad, but a lack of pleasure in things, and that's called anhedonia. And men seem to have that more than women, and so, and they also turn as a coping mechanism to substance abuse, and so it could just manifest itself. That was the whole point of it, that men and women differences in how it manifests. So it could manifest itself differently. Substance abuse problems versus depression in women. Yeah, still early stages in this, because we had people like me that studied estrogen, we got a slap in the face with that. There was a huge study, 10,000 women, using that Premarin. And so a lot of people weren't interested in funding that research anymore. It turns out that they were using women that were 65 years or older and then giving them. So I didn't show you half that meta-analysis was at menopause versus 10 years after menopause. So you see much less of a beneficial effect after. So you're better off to take it early rather than late. And you're better off probably to take one form versus another. It's interesting, if you look at, there was a new study out that showed that OBGYNs they're taking it at higher levels than the general population. So I guess you'd sort of suspect that they're reading the literature and they're realizing, no, it actually does make a difference. So I think you're better off to take it earlier and just monitor yourself, because there is a higher risk for breast cancer and possibly cardiovascular disease. But another new study just came out yesterday showing that it matters which kind of hormone you're taking for cardiovascular disease, prevention of stroke. So, I mean, the thing is, my mom has Parkinson's disease. She's like, I got the men disease. And I'm like, I know, I'm sorry. And she says, why haven't you figured it out, Lisa? When she just gets really angry with me. And I say, well, I don't study Parkinson's, but I say, Mom, if it was simple, we would have figured it out. It's not simple. And unfortunately, people want simple, but it's not simple. And we have to stop thinking it's simple and start trying to tease it apart. That's the fun part of science, is trying to figure it out, I think. Actually, no, so the slide I showed, the older brain didn't show that plastic response, and there's a lot of data out there to show that antidepressants don't work well in Alzheimer's disease, probably because of that lack of plasticity that's out there. But one of the challenges will be, can we boost plasticity and then I have a whole other area of research looking at plasticity of the brain and hormones to see, can we boost that level and then get antidepressants to work? Yes, I mean, some studies find no and some studies find yes, but overall the evidence is yes. It's like exercise. Exercise is like the most important thing, physical exercise, but beyond that, exercising your brain is also important. And so for somebody like my mom who can't work out anymore, something that's really important to know, there's a lovely lady, Teresa Louis-Ambrose, researcher. She's in physiotherapy here at UBC, and she's found that resistance exercise, just lifting weights, boosts cognition. So that's, even if you can't go out for your 5-mile jog, go and lift some weights. And it looks like we're working a little bit together to see if it's working more in women than in men, and it looks like it works more in women than in men. But yes, I definitely keep doing your Sudoku. They say learn a new language. Anything to exercise and keep that brain active is important. But some things like traumatic brain injury really increases your brain activity. That's not good. Don't do that.